pandemic, we had to, we had so many examples of how the hospital couldn't be prepared by itself, and we had to rely on our community partners.
Working with our community partners, understanding how they were prepared in order to manage and take care of COVID within their agency. Did they need support, and vice versa? We did come together throughout the incident to really collaborate around how we're going to care for our patients in our community.
Yeah, there were so many scenarios that you had to think about. Like, what about the corrections department? What's going to happen, you know, with our homeless community? What's going to happen in the long-term care facilities? And I know that you know, we had collaborations with each of those groups.
There was really no stone unturned during this. We really did look at many opportunities and think differently.
I was really grateful for those community partnerships and grateful for this community that it leaned in instead of pulled out, because I think it would have changed. It definitely would have changed the work that we did in this room, and it would have changed potentially the outcome. This incident was unique in the sense that one patient can turn into 4 patients, can turn into 12 patients in the span of 5 days. And now suddenly you go from managing a singular case and plenty of resources to having to make tough ethical decisions.
We went into this pandemic knowing people's first names at every hospital, every health department, regional and statewide center, and we even knew our names of our federal partners. And that was extremely important so that you could cut through some of the red tape.
So another great example of our community really stepping up and supporting us was Pam Cross and her wonderful sewers group, who really stepped up and made us hundreds, if not close to thousands, of masks to be able to start with, to support our staff, so that when we started implementing where everybody who was in the building for staff needed to be wearing a mask, we had the supply to support that, but also then kept going so that we could offer them off to our patients as well. So if patients arrived in the organization and didn't have a mask, we were able to provide them with a mask.
Having the local law enforcement, fire, EMS do the Monday 6 p.m. parade kind of gave us, who were all on the inside, hope.
We put a request in, and within days we got what we needed. For instance, we asked for a squad of soldiers to help us set up the Collins Pearly. Asked them to report at 8 o'clock. Well, at 7:30, there's 2.5 squads there. And along with local partners.
In our long-term care facilities that I referenced just a minute ago, it was super important to involve them in our planning sessions for some of our testing plans, our PPE plans, because our goal was to keep those patients safe in situ in the long-term care facilities as much as we could if someone came up positive. Because as soon as they started coming here, not only did it increase risk for them, which of course was the most important thing, but it potentially drained our resources to be able to help the rest of the community be successful. I think our best partner, though, truly was our local funeral homes, because thankfully we never saw these numbers, but we were clearly preparing for the notion that we might have 20 or 30 decedents who were COVID positive, and then how do we manage that? Where do they go?
I was able to redirect and work with Dr. Dan Durand, who had asked for someone to do some of the epidemiology. So epidemiology was involved with both looking at patients that were in the hospital that were sick with COVID, and also other patients and community members that may become sick, and doing sort of a tracing on that. So working with Dr. Dan Durand, I got connected with the Vermont Department of Health, and I knew some of those people already, but under other circumstances. So I worked pretty closely with the 2 field nurses, Destiny Kaju and Stacy Carpenter, and we forged a good process to look at our current patients. And you know, I was educated on many things related to the contact tracing, and also was able to connect with both home health, Franklin County Home Health, that had a lot of associations with some of our community members, and also with the long-term care facilities and other assisted living residences. So I was a liaison for them. The relationship that I now have with the Vermont Department of Health will go on forever.
One of the biggest things for me was just seeing the community come and deliver things. You know, and having the community want to do things for us. You know, we had to create a donation czar to be able to just capture all of that because we had so much community support. And I think that was a huge thing. You know, there was one day that we got coffee and donuts from one of the local churches, and you know, the fact that they went and got, you know, bakery donuts and nice coffee shop coffee, and they really, you know, really treated us. It was very nice. And you know, the fact that we had so many places that wanted to just donate a meal and were bringing in food regularly or trying to bring in food regularly. We had community members who wanted to cook for us. Having that community support, I think, really helped our staff feel like they were on the right track. You know, and it was something different, you know, because we always say we appreciate each other and things like that, but it's something different when an outside source says thank you.